What in the world are zygomatic dental implants, and what are they used for? I'm Dr. Paul Anderson from Peachtree Oral and Facial Surgery, right here in Peachtree City, Georgia. Today, we're discussing a specialized topic that can be an absolute game changer for many people. Zygomatic dental implants. If you've been struggling with missing teeth or have been told you don't have enough bone for traditional implants, this video is definitely for you. We'll cover what zygomatic implants are, how they work, and who can benefit from them. So what exactly are zygomatic dental implants? Unlike traditional dental implants that are anchored in the jawbone, zygomatic implants are longer and are anchored to the zygomatic bone, also known as the cheekbone. This bone is denser and offers a strong foundation for dental implants, making them an excellent option for patients who have experienced significant bone loss in their upper jaw. Zygomatic implants are particularly beneficial for several reasons. Number one, bone loss solutions. Many patients who have lost teeth may also lose bone density in their jaw over time. Traditional implants require enough jawbone to secure them properly. Zygomatic implants provide a solution for those who don't have sufficient bone, allowing for successful implantation without the need for extensive bone grafting. One of the significant advantages of zygomatic implants is the ability to provide an immediate loading. This means that you could potentially have your new teeth placed on the same day as the implant surgery, which is a huge benefit for those looking to restore their smile quickly. Number three, improved stability. Because zygomatic implants are anchored in the zygomatic bone, they offer enhanced stability, especially for full arch restorations. This stability allows for better function and comfort when eating and speaking. Now, let's briefly discuss the procedure for zygomatic implants. It typically involves the following steps. Consultation and planning. We start with a thorough consultation, including imaging like CT scans to assess your bone structure and determine if zygomatic implants are right for you. Surgery. The procedure is usually performed under sedation or anesthesia for your comfort. The implants are carefully placed into the zygomatic bone. Immediate loading. In many cases, we can place a temporary prosthesis on the same day, allowing you to leave the office with a functional smile. Follow-up care. After the surgery, we'll schedule follow-up appointments to monitor healing and ensure everything is progressing as planned. Now, who can benefit from zygomatic implants? They're ideal for patients with upper jaw bone loss. If you've experienced bone loss due to periodontal disease, trauma, or prolonged denture use, zygomatic implants can provide a solution. Number two, those seeking immediate results. If you want to avoid the lengthy process of bone grafting and want quicker results, zygomatic implants may be an excellent choice. Number three, individuals looking for full arch solutions. If you need full arch restorations, zygomatic implants can support a complete set of new teeth, improving your quality of life and confidence. In conclusion, zygomatic dental implants are a remarkable solution for patients with upper jaw bone loss, offering stability, immediate results, and a chance to restore your smile effectively. If you think zygomatic implants might be right for you or have any questions, please reach out to us at Peachtree Oral and Facial Surgery and schedule a consultation. We're here to help you explore your options.